Okay, our last video for this week is going to focus on disorders of the respiratory system. So these disorders can fall into a few different categories, and we're going to talk about oxygen imbalances and a few other categories, including cancer. So we're going to start with when there's an imbalance of oxygen. The general term is called hypoxia. So it's a deficiency of oxygen in a tissue, or there's enough oxygen being delivered, but it's the inability to use that oxygen. And usually hypoxia is the consequence of respiratory diseases or disorders. And it's going to fall into a few different separate types. So hypoxemic, oh, there's no N in there. Hypoxemic, hypoxia, which just seems like a very ridiculous name to me, is when the pressure of oxygen in the arteries is low. So that could be usually due to not enough gas exchange in the pulmonary circuit. And so when there's oxygen deficiency at high elevations, that would slow down ventilation. Drowning could be a source of this, respiratory arrest, but any of those could be why there is a low arterial pressure of oxygen. Another type of hypoxia, ischemic hypoxia, is from inadequate circulation of blood, and that could lead to congestive heart failure. Anemic hypoxia is due to anemia resulting from the inability of blood to carry enough oxygen. So we've used the term anemia before. There's different types of anemia, but putting those two together, anemic hypoxia. So if there's enough, the blood isn't able to carry oxygen, and anemia results. And then histotoxic hypoxia, these names are ridiculous, is when there's maybe a poison such as cyanide to prevent the tissues from using the oxygen that's delivered. I would say that's probably the least common type, but a sign of hypoxia is when the skin turns blue, and technically that's called cyanosis. This talks about it's safe to breathe oxygen, pure oxygen, for a few hours, but I don't really think that all of this is really necessary. It used to be that premature infants were used this type of treatment, but it is discontinued. Okay, into our next kind of category of respiratory disorders, we're going to look at COPD. COPD refers to any disorder where there's a long-term obstruction of airflow, and so that obstruction of airflow is a reduction in the pulmonary ventilation. So not enough air coming in, and so COPD stands for chronic obstructive pulmonary disease. That means you're long-term with this airflow obstruction. So major COPD includes chronic bronchitis and emphysema, which are usually associated with smoking, but not always. And then the risk factors could include air pollution or occupational exposure to some airborne irritants. So let's take a look at them individually, bronchitis and emphysema. In chronic bronchitis, the cilia don't move, and they are also reduced in number. And so the goblet cells are enlarged, and they produce more mucus than normal. And so this develops a chronic cough to bring up that extra mucus, but then less cilia to move the mucus, so it kind of builds up. So mucus and cellular debris is formed. And then this is kind of a great place for bacteria to grow. And so smokers have a chronic infection and inflammation of the bronchial tubes or bronchi. Another COPD is emphysema. In this disease, the walls of the alveoli break down, and so the lungs have larger but fewer alveoli. And so that's not enough gas exchange. There's not enough membrane for gas exchange to occur. And so also the lungs are less elastic. They're more rigid, and sometimes the air passages are collapsing. So this can, again, obstruct the outflow of air, not only the inflow, but the outflow, and that causes the air to be trapped in the lungs. Patients with emphysema are spending more energy and more time just breathing, and so they're not able to use that energy other places in their body because they're using so much just to breathe. Okay, this is still talking about COPD, and so COPD reduces pulmonary compliance and the capacity. And then the last category is going to be cancer. So we're going to look at lung cancer types and then talk about how smoking impacts that. So lung cancer accounts for more deaths than any other form of cancer. And the most important cause is smoking. There's 15 known carcinogens. Carcinogen just means a substance that we, based on research, know that it causes cancer. So the most common type of lung cancer is called squamous cell carcinoma. It begins in the bronchial epithelium, and that epithelium transfers from the normal ciliated pseudostratified that you would expect to see in a healthy person. It transforms into stratified squamous. And so the dividing cells, the cancer cells, invade the bronchial wall, cause bleeding lesions, and the keratin is what's replacing the functional respiratory tissue. So think about all the way back to different types of epithelial tissue. The stratified squamous is what we see in our outer layer of skin. So that is full of keratin and hard, and so that is not what we want lining our respiratory tract. Another type is adenocarcinoma. It's where mucus glands are the origin of this type of cancer. And then small cell or oat cell carcinoma is the least common, but it is the most dangerous. The cells clusters look like little grains of oat, and it starts in the primary bronchi but invades the mediastinum and metastasizes quickly to other organs. That means the cancer spreads to other organs. Anytime we're talking about a cancer that is quickly moving to other organs, it is always more dangerous. So most lung cancer types originate in the primary bronchi. The tumor is going to invade the bronchial wall, which could compress the airway, and again, that's going to reduce the airflow. And so sometimes the first sign is coughing up blood, and then the lung cancer is able to move quickly. So usually the moving on to other organs has occurred by the time of diagnosis. Usually it moves possibly into the pericardium, the heart, the bones, liver, lymph nodes, and brain. After diagnosis, the prognosis is usually poor. Only 7% of patients survive 5 years.